Discuss some of the questions today for the exam. What must be known on legal points of delegation when processed to a new nurse? Options: evaluation of performance of delegate by clients, actual time it takes to complete the task by delegate, institution definition of the job description of new nurse, and number of times that the delegate has previously tasked. So the correct answer is institution definition of the job description of new nurse. Next question. The nursing director wants to evaluate the quality of nursing care at the inpatient area. The management team will evaluate on quarterly basis the documentation and the relationship between the patient's length of stay and the quality of care. Which of the following is the most important data source to identify the quality of care? Option: patient complaints and time taken to resolve them, patient satisfaction level at the time of discharge, details of nursing notes for patient's progress. So the correct answer is patient satisfaction level at the time of discharge. The nurse manager receives complaints from some nurses on improper work distribution and discrimination. How should the nurse manager handle this situation? Options: investigate the complaints, individual counseling, identify list of problems, continue to observe. So the correct answer is investigate the complaints. So that is the first step. She should investigate prior to all these things, right? Okay. Which of the following is the most appropriate action for a head nurse starting at a new hospital? Option: make immediate change at the unit, plan and coordinate new strategies, assess unit activities for at least 3 months, and ask about the previous head nurse managerial style. So the correct answer is plan and coordinate new strategies. Assessing unit activities for 3 months is a quite long period of time. So the correct option is plan and coordinate new strategies. After teaching deep breathing and coughing exercise to a patient undergoing surgery, the nurse asks a written demonstration and help him in correcting what part of therapeutic communication is used. Answer: evaluation, intervention, identification, and demonstration. So the correct answer is evaluation. The intensive care unit nurse manager plans to delegate some task to a nurse. What is indicated for a successful delegation? Option: nurse manager supervises the nurse. Nurse has the authority to change the task. Nurse manager check task sometimes, and nurse manager asks another nurse to check the task. So the correct option is nurse manager supervise the nurse. See you in the next lesson.